And now along the virtual health lines, we have two people who are literally reinventing women's health as we speak. We have Dr. Karen Patrusky and Heidi Edlstein from Verbena, which is the hottest digital health company in women's health out there right now. And they're going to talk about their business model, their virtual first health model with Dr. Sara Chokshi, who's the Director of Research at HITLAB and has been doing HITLAB and digital health efficacy testing across the ecosystem now for over a dozen years. Dr. Chokshi, thank you for leading this next panel.
Thank you.
Hey, thanks, Dan. It's great to be here with everyone. Yeah, so I am privileged to be here with Heidi Edlstein and Dr. Karen Patrusky, who are co-founders of Verbena. And so why don't we start there, Heidi, Karen, if you wouldn't mind just, giving us a quick introduction, a little bit about, yourselves and your perspective, and a little bit about Verbena.
Sure. Thank you for having us. So I'm Karen Patrusky, and I'm an obstetrician gynecologist. I'm a practitioner. I can't believe that I can say that I've been practicing for about 3 decades. So I'm at the stage in my career where I'm delivering babies of women I've delivered and taking care of their mothers and grandmothers, and it's inherent in my DNA, and it's a privilege. But I have to say, the past decade or so, the ability to deliver care has become much more challenging, and that's compounded by the pandemic, making it even more, in many respects, frustrating and challenging, and I hate to say it, but maybe in some respects less rewarding. And that's where Verbena came from, really, to drive a solution, primarily for the healthcare provider, but also for my patients. I'm trying to improve the quality that we can deliver, to sustain the longevity of the practitioner and give a good product without driving up the cost of care. So I had this vision, and my brilliant best friend had the vision to bring it to life, and that's Heidi. So.
Okay, so thank you, Karen. Yes, Karen, thank you. I love you. So, as Karen mentioned, it's funny because we're both, personal friends and professional colleagues, and it's been a really amazing journey that's been, for several years. Personally, I have over 25 years of marketing and branding experience, and have worked in the women's lifestyle category for my entire career, particularly in media, but with, hundreds of clients that target women. I am the daughter of an OBGYN, and that's one thing that Karen and I bonded with, 20 years ago when we first met. So I understood the challenges and pain points that she was experiencing in her practice and in her industry. And as she talked about medicine, today, and my dad had a beeper and was on call all the time. So I certainly understood the challenges of that particular category of medicine. So when Karen and I started, talking about her vision, I thought, as a marketer and as a believer, that I could bring her idea to life, both operationally and help to create a bigger and broader women's health brand.
Awesome. Thanks, Karen. Thanks, Heidi. It's great. And it's lovely to be among friends. So let me just ask this, because Karen, you hinted at this, and I understand, from things that others have covered, that a major takeaway from Vive and Hints this year was just how much virtual care has changed the landscape. Kind of along with what you said, Karen, really changed the practice of primary care. So as a clinician, and both of you as leaders in women's health innovation, can you talk about what you see as the key opportunities virtual care presents specifically for women's health?
Sure. Hey, do you want to look at it from the patient or?
Actually, I'll start from the patient's perspective, just because
Awesome.
it's quite literally convenience and value. It's a convenience and value proposition. Virtual health offers an accessible and affordable option to an in-person and in-office visit, and it complements and supplements regular medical care. As a mom or a full-time employee who commutes or actually lives in a kind of remote area, virtual care provides quality care for routine checkups and consultations, testing results, diagnostics in a safe and secure, convenient setting. And it's a win-win-win for patients and providers and insurers. So that's, the opportunities from, my perspective as a patient and as a co-founder, but as a patient in particular.
And from the physician's perspective, I mean, this has been a pain point for me for a long time. And the initial rumblings of Verbena were thought of well before the pandemic, and certainly escalated significantly. So hopefully from the chaos that we had all lived through, patients, providers, through the pandemic, we can now learn from that chaos and reflect upon it. I mean, we're certainly all humbled by it, right? We used to think of a remote visit was probably something significantly less than, and now we know that it can be something so satisfying, such a quality visit, and it really has no stigma, and in fact can make it a much more authentic visit. And pre-pandemic, I mean, there was just a smattering of telehealth visits. During the pandemic, we almost completely converted, and we certainly have not relinquished. We're only going skyward on this. I think that there is still a tremendous room for growth in this market. And that's because a high-tech visit does not mean that it can't be personal and have a high-touch quality to it. So if we really do consider, healthcare as something for the consumer, and recognizing that there's, more than one consumer involved, right? It's the patient, but it's also the provider. If we can make the digital component be in alignment with those two, where we can keep that connection and the relationship, we can have such an improved quality visit. You're going to increase the workflow for the provider. You can increase availability for the patient, and it's going to be a qualitative visit. And if it's qualitative, you're going to end up with a better health outcome. So the one thing that I don't see, which you hear a lot, is I don't see virtual care as a disruptor, and I don't see it as revolutionary. I really think it's a cooperative change. It's an ancillary way for doctors to be agile with their patients. I feel that it's complementary and can just deliver an overall better experience to both patient as well as that healthcare provider. So.
Great. No, thank you both. And Karen, that's really interesting, and I think the way you frame it really highlights something I've understood to be a differentiator for Verbena, which is, thinking not about just virtual visits, but that, it's a service and a relationship that virtual just supports. That relationship exists anyway. So it's really about supporting, maintaining, which I think particularly with the pandemic kind of, maybe sped things up, but was a great opportunity in this time when we couldn't be together to let, a woman and her physician be together. I can only imagine what it must have been like to, be pregnant and going through a course of prenatal care in the middle of the pandemic. And I know a lot of people who've done it. So really interesting. Just quickly,
And some did it twice.
yeah, right. Yeah, were there any surprises? This is a little bit of a surprise question, but I'd just love to hear from you for 1 second, in terms of, I think a lot of concern around virtual, I know for myself is, can it be high touch? Can it be personal? And that could be a potential pitfall. Could you discuss that for just like 30 seconds? Do you see that as a pitfall? And if so, how does Verbena design around that?
So I think that if virtual is not designed properly, there certainly can be pitfalls. Medical care can never be 100% automated care. You cannot replace the healthcare provider. You have to marry the two. You have to blend the personal in-person visit when necessary with technology. I think that you can't fragment the care. So one of the problems and a big pitfall, how things have grown too quickly, is sometimes patients are ordering tests for themselves. They're hopping from virtual person over here to virtual provider over there. And it's not collaborated and it's not connected. So in my opinion, keeping that healthcare provider at the center of the equation to guide the way that care is delivered to the patient will be a much more satisfying visit for the patient. The bottom line will be a better outcome in terms of the health of that woman. And going back to, high tech and high touch. I mean, sometimes the visit, the stigma is taken away when she is in her own space, when you're not putting a third party in between the patient and the partner and the patient and the provider to ask those questions.
Mm-hmm.
It can be a much more authentic visit because she's not going to feel like she has to relay her information to a third person. And, think about it in terms of Verbena as a gynecologic platform. When I speak about it, that it's a gynecologic platform done digitally, I mean, you can imagine what's going through people's heads. I mean, they're thinking, it's got to be pornographic in some way. But the reality is you're really giving them a safe, quality, thorough ability to manage many sensitive sexual health and reproductive concerns.
Mm-hmm. Great, super interesting. So, we only have a couple of minutes left. I think it's pretty clear how Verbena is building kind of at the forefront of these themes, that we saw in Vibe and Hymns about not just the patient experience at the center, but also the clinician experience at the center and how those are intrinsically, related. What's next for Verbena?
I'll jump onto that one. We weren't developed as just a telehealth option in response to COVID. I mean, certainly we pivoted and we grew and we evolved because of it, but that's not where the sort of the past of Verbena was, and that's a whole nother story. But we today and in the future envision Verbena to be a total women's health solution beyond, reproductive and gynecological care. We kind of say like a one-stop doc for all women's health. And we'll continue and grow as a platform and a product and a brand that will be a resource and solutions for all women's health, mental health, heart health, nutrition, well-being. We're going to follow and support her journey, the women's health journey, but again, as always, in partnership with her personal care provider. So that women's health journey, as we're sometimes calling it, will all be a coordinated effort with all of her caregivers. Mm-hmm. And we will always continue to include additional services, products, content, education, community, so that Verbena will be a trusted resource for all women's health.
Love it. Well, I know there's many of us at the lab who are super excited to see where Verbena is and where you all will go. So Heidi, Karen, thank you. Just make sure you look, there are a couple specific questions for you all in the comments. Someone asked about business model. So please connect.
We will. Thank you.
Thanks so much.
Thanks so much.
Thank you. Thank you, Stan. Thank you for that.
It's great to see you all. And again, thank you for your time. We know how busy you both are. And again, thank you, Dr. Sara Chokshi.
Thank you, Sarah. Bye.